Vibramycin is a medication that treats bacterial infections and acne. It can also be used to prevent malaria. It's a type of antibiotic that stops the growth of bacteria. It's important to note that Vibramycin only treats bacterial infections and will not work for viral infections like the common cold or flu. Using antibiotics when they're not needed can cause them to not work for future infections. Before you start taking Vibramycin, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth on an empty stomach, usually 1 or 2 times daily, with a full glass of water. If you experience stomach upset, taking it with food or milk may help, but it may not work as well. It's important not to lie down for at least 10 minutes after taking this medication. Avoid taking Vibramycin with products containing aluminum, calcium, iron, magnesium, zinc, or bismuth subsalicylate. If you are using the liquid form, shake the bottle well before each dose and carefully measure the dose using a special measuring device/spoon. The dosage is based on your medical condition and response to treatment. Make sure to take this medication at the same times every day for the best effect. Continue taking Vibramycin until the full prescribed amount is finished, even if symptoms disappear after a few days. If your condition lasts or gets worse, be sure to tell your doctor. Some side effects of Vibramycin include stomach upset, diarrhea, nausea, or vomiting. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any severe side effects, such as difficulty swallowing or signs of kidney problems. Additionally, tetracycline drugs like doxycycline may rarely cause increased pressure around the brain, particularly for women of childbearing age who are overweight or have had intracranial hypertension in the past. In rare cases, this medication may also cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms like persistent diarrhea, abdominal pain, or blood/mucus in your stool, seek medical attention right away. Prolonged use of this medication may also result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice any new symptoms. While a serious allergic reaction to Vibramycin is rare, it's important to seek immediate medical help if you experience symptoms such as fever, rash, itching/swelling, severe dizziness, or trouble breathing. Lastly, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking Vibramycin, talk to your doctor or pharmacist if you have any allergies, especially to other tetracyclines. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Let your doctor or pharmacist know about your medical history, especially if you have trouble swallowing or esophagus problems. Vibramycin may affect how well live bacterial vaccines work, so tell your healthcare professional if you are using this medication before getting any immunizations. Before having surgery, make sure to inform your doctor or dentist about all the medications and products you are using. Be aware that Vibramycin can make you more sensitive to the sun, so take precautions to protect your skin when outdoors. If you are pregnant or plan to become pregnant, talk to your doctor about the risks and benefits of using Vibramycin. This medication can also pass into breast milk, so consult your doctor before breastfeeding. Now let's talk about drug interactions. It's important to know that certain medications can change how your medicine works or increase the risk of serious side effects. This list doesn't include all possible drug interactions, so it's best to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, don't start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with Vibramycin, such as retinoid medications taken by mouth, barbiturates, blood thinners, digoxin, anti-seizure medications, and strontium. It's also important to note that this medication may interfere with certain lab tests, so make sure to let the lab personnel and all your doctors know that you're using this drug. If you suspect someone has taken too much Vibramycin and they are passing out or having trouble breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. Remember not to share this medication with others. If you're using this medication to prevent malaria, keep in mind that it's still possible to get the disease even if you've been taking it. Try to avoid getting bitten by mosquitoes, especially from dusk to dawn. Stay in well-screened areas, wear protective clothing, use insect repellent, and sleep under bed nets. This medication is only meant for your current condition. Don't use it later for another infection unless your doctor says it's okay. While you're taking this medication, you may need to do some lab and/or medical tests like a complete blood count or checking your liver/kidney function. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the one you missed. Then take your next dose at the usual time. Don't take 2 doses at once to make up for the missed one. Make sure to store Vibramycin at room temperature, away from light and moisture. Different brands of this medication may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist. It's important to keep all medications out of reach of children and pets, so don't store them in the bathroom. When it comes to getting rid of Vibramycin, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, properly discard it when it's expired or you no longer need it. Taking outdated tetracycline-related drugs can lead to serious illness, so it's best to consult your pharmacist or local waste disposal company for the safest way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.